This next story, and there have been so many stories coming from Bill 2, the government law, their bill being imposed on doctors, some, of course, choosing to leave. And then this afternoon, which comes from our next guest, Dr. Michael Kalin is a family physician. He's also director of the Kildare Family Medicine Group, and sent a letter today to the directors of the CS West Island, basically calling into question the viability of the clinic he is in. And Dr. Michael Kalin is on the line. Thank you for being here, Dr. Kalin. Appreciate your time. Look, I was reading a translation at you. I know you sent your letter in French, so I did the best I could with Google Translate. What was the nature of what you're telling, or what is the nature of what you're telling the CS as far as your future is concerned there?
Well, first of all, thank you for having me. I really appreciate it. So in CS Centre-Ouest de Montréal, so this is the Centre-West territory, the CS, there are 20 family medicine groups, and I represent one of those. And we see collectively over 400,000 patients. That's who is registered to us. We offer more than 1 million appointments a year. And the letter was sent to the head of the CS, Dr. Rosenberg, as well as the DTMF, which is this regional territorial body of family doctors, a cry for help, saying under Bill 2, we will not be able to continue to operate. April 1st is coming in less than 6 months, and we don't have the operating budgets to continue. We may need to close.
What does April 1st represent?
So the GMFs it's a contract between clinics and the government, and it's renewed every year on April 1st. And this year, the government has introduced new rules and new funding models for GMFs. And this, together with Bill 2, is going to make our job so much more difficult that we may not have the operating income to continue. We may need to shutter our doors.
All right, let me clarify for people listening. When you say GMFs, we're talking family medicine groups, right?
Exactly.
Okay.
So we know that there's 2,000 family doctors short in Quebec. Well, we're more than 400 family doctors short in Montreal alone. But this is where the center of primary care is done, is in these groups.
You also mentioned, if I understand it in your letter, beyond being a medical practitioner, you own this particular clinic, or you're one of the owners in this clinic that you're in. But you mentioned at the same time there are 20 of these clinics right in this part of the city. How many of the others from who you've spoken to are in the same situation, or you think will be in the same situation as you come April 1st?
The letter was signed by every GMF in our territory, with the exception of those that are based in a hospital and in some CLSCs. We are all feeling the crunch. And this is not just the island of Montreal, this is across Quebec, because this cadre, this contract, and this law affects us all.
When you talk about the effect of this, so again, I'm reading you say many clinics will experience a loss of more than 50% of their operating revenue. How does that come into play? Is that because you're going to be you're being cut back on what you can actually get, or how does it work?
Well, GMS, family medicine groups, are basically PPPs, private-public partnerships. They're owned by, maybe a physician or a business, but mainly physicians. And we pay the rent, we pay the salaries,
right.
We pay for the equipment, the computers, the IT. And the government, they provide us with some resources like nurses, maybe a pharmacist, maybe occupational therapist. And they, in return, expect us to be open certain hours to provide care for the population, for our registered and non-registered clientele. And the problem is that we rely on two sources of income to keep our doors open. One is from the doctors through an overhead, and the other is from the government through this contract. Well, we know with law number 2 that doctor salaries are going to go down by at least 30%, probably closer to 40 or 50%, and therefore that translates into less income for the clinics. And at the same time, the government has dramatically cut the amounts that they'll be sending to GMFs. In my clinic, it'll be down by more than 50%. So regardless, irrespective of what the government says about this phantom $50 or $100 million fund, nobody has ever seen this. We have no idea what they're referring to. These are all just sort of vague wishes and promises. The reality is we have, an Excel file which shows our income in and our income out. And we have fixed expenses. And on April 1st, we are concerned we will not have enough to keep our doors open. the payer staff.
All right. So obviously, there have been no direct consultations between your group. You have to go through, obviously, the directors of the Cs you mentioned off the top. The idea here with writing this letter and sending it is to do what exactly?
It's a cry for help. Because right now, the GMF contract is not negotiated. It's imposed by the government on the GMFs, on the family doctors. The government's not speaking to our union right now, the FMOQ. In fact, as you know, in the middle of the night, they put in a gag order and they pass Law 2. So this is just getting worse and worse. We know that Law 2 is going to cause the slow trickle exodus of doctors from our system. And this is death by 1,000 cuts. But when you stop the funding to a GMF, we're talking about a guillotine. This is tremendous. This is catastrophic. If the GMFs close in Central West, that will mean that 400,000 patients will be orphaned. How are we possibly going to make that up? And this isn't just in RCS. This is across the island, across the province. This is potentially the end of our system. And it is absolutely mind-boggling that this has not been discussed, that the ministry is not addressing this. But at the end of the day, like I said, this is a financial decision. We have responsibilities to our staff. We have to provide excellent care to our patients. And if the government is saying through Bill 2 that we need to be open longer hours and provide more appointments and more care, we are responding, how can we do that with less resources? And the answer is, we can't.
You know, the government, of course, always lays this out as a way to make the system more efficient and obviously to save money. That's got to be the bottom line in this. Do you understand how that would work? How does this become more efficient when you risk? And I'm sort of, I'm understanding where you're coming from here, right? And I understand you have to run a business. You have overhead like everything else. Yet you're being told you'll have less to run it than you did before. How does this make any sense?
It doesn't make any sense. And that's the problem. Our clinic runs a 93% patient fidelity rate. All the GMFs together in our territory are over 90%. That means that we are providing superb care. We prevent our patients from going to the emergency room. And if you get rid of that, we're not going to be talking about 12-hour waits in emergency rooms. We're going to be talking about 1 week waits in the emergency room. It is mind-boggling that the government would attack the very providers of the public system, the first line and the last line of care in the community. And we are the doctors who remained in the system. We didn't go private. We didn't leave. We're the ones who remained. If we look at our territory, there have been clinics that have closed or restructured in the last 3-4 years. We're talking about Westmount Square, Brunswick, Lotus, Bloom, Elma, Tiny Tots, Forest Medic. There's no surprise here. The ones that are remaining are the mom and pop, the doctor-owned clinics. We're committed, but there's only so much that we can do. We want to find a solution. We certainly don't want to frighten our patients. I don't want everybody panicking and calling the office. I have no intention of closing. I certainly don't want to. I want to be here. I want to be part of the solution. But the government has to open up their eyes and recognize that they need to work with us here, because at the end of the day, April 1st is coming in less than 6 months, and we need to find a tangible, concrete answer to this. And we're available. This was the purpose of the letter. Please respond to us. Find us a way to make this work.
I'll ask you one last question, because we've had other people come on earlier in the week and last week as well and talk about the fact that if things don't change, and let's say for all intents and purposes there is no change, the government sticks to its sort of landing here and says, I'm sorry, this is just how it's got to be. Are you considering leaving? Would you consider doing that if this doesn't get resolved?
My family is here. My children go to school here. I have invested hundreds of thousands of dollars into building a clinic that I'm very proud of, that I believe provides exceptional care. I want to continue to serve my patients. I'm also a patient for someone else, and I want to make the system work. But I think at some point everybody does have a breaking point. So this is a cry for help. This is a plea to the public. Sign the petition. Write your M&As. Write Minister Dubé, Premier Legault. Tell them that this is untenable. Tell them that we need a real solution. We're past the posturing. We need real discussion. We need mediation or arbitration, but this is not going to end well. We are sleepwalking towards January 1st when this bill will be implemented. It's already been passed. It needs to be removed. It needs to be withdrawn. And we need a real, tangible solution. And if we do nothing, January 1st will come and April 1st will come, and we will see the closure of many GMFs, and it will be catastrophic. We have to, together, prevent this.
Dr. Kalin, just final question. You mentioned a petition. Is there a petition online people can go to and sign?
There is. It's actually an official petition that was put out by one of the MNAs, I believe from the Liberal Party. I could perhaps send that link to you afterwards. Sure. And, of course, reach out to your MNAs, send emails, call. It really does make a difference. It's going to be the public who will save the system. The doctors, we're doing our best. We've made a sworn oath to protect you, and we're trying to do that, and we will do what we can, but it's going to be the public who will make the change, who can speak up. Right. And we're really we're asking for your help.
I will pass that on if you send it on to us or send it on to Alice, who contacted you. I will mention that as well and let people know where they can sign. Thank you so much for your time. I very much appreciate it. Wish you the best.
Thank you. I really appreciate it.
Take
Have a wonderful day.
Dr. Michael Kalin. It's the last thing you want to hear, right? A family medicine group thinking about having to close if this thing actually goes through. And that's one of 20 different groups.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian-owned and operated. Charm has been part of your love stories and bromances for over 50 years. And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.